And just hours after the WHO declaration, President Donald Trump announced that the United States will suspend all travel from Europe for 30 days to slow the spread of the virus.
To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight.
However, the travel restrictions will not apply to the UK, which, according to Mr. Trump, has taken more precautions than the European Union against the virus.
Meanwhile, India's Ministry of Health announced on Twitter that all existing visas issued to foreigners, except those on official duties, remain suspended until April 15th. But visas of all foreigners already in India are valid.
In Italy, a hospital in the southern city of Naples is assembling a new intensive care unit as the healthcare system braces for an epidemic. Italy is the hardest hit country in Europe, with over 800 deaths and nearly 12,500 people infected.
And in the UK, Prime Minister Boris Johnson is set to announce that the country is moving to the second phase of its 4-tier plan to manage the coronavirus.
But the number of fresh infections in the epicenter of Wuhan dropped to a new low of 8. The whole of mainland China saw 15 new cases. Another 11 people died, which is the lowest daily increase since late January. Well, yesterday, Dylan had an interview with Professor David Heymann, who was the World Health Organization's Assistant Director General for Health Security and Environment. Professor Heymann is based in London, but he's in Singapore this week.
Joining us now is Professor David Heymann. He's a Professor of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine, as well as the head of the Centre on Global Health Security at Chatham House in London. Welcome, Professor. Thanks for joining us. Now, the first question, an infectious diseases program leader was on the show earlier this week, and he said the virus is here to stay at least until the end of the year. What are your thoughts on this?
Well, that's a good estimate of what might happen, but it's only an estimate. And we really don't know what this virus will be doing at the end of the year, but it looks like it now is transmitting fairly easily in communities in Europe and around the world, and it's very likely that it will continue to transmit at least for a time.
Now, Professor, speaking of the virus, is the virus changing? And if it is it for better or for worse?
Well, looking at the genetic sequence of the virus, which is one way of determining whether the virus is stable or not, it appears to be quite stable. And it's stable, and it's never been linked yet with either virulence, which means how easily it causes disease, or with transmissibility. So what we're seeing is a virus which is stable and which hasn't altered either in its transmissibility or in its virulence.
Now, Professor, let's move along to cruise ships. Now, some countries are not allowing cruise ships to dock at their ports for fear that they could spread the disease in the day or two that passengers and crew spend in a country. Are cruise ship passengers a greater risk than passengers coming in by plane?
Well, cruise ship passengers are a risk because they're enclosed in a space and they can't move around.
Right.
And so if there's transmission during the period that they're on that cruise ship, they're very likely to get infected if they're exposed to the virus. On an airplane, it's been shown in the SARS outbreak back in 2003 that the people who are at risk are only those who might be sitting in the row in front of or in the row behind someone who has the infection. So there would be less possibility of infection on an airplane than on an enclosed space, for example, on a cruise ship.
Now, Professor Heymann, let's look forward. How do you think things will develop? Will more countries face sudden outbreaks like what we saw in Italy?
What we're seeing now is that countries are trying their best to contain outbreaks which occur in their country and which are discrete, such as has been done here in Singapore. So countries are trying to interrupt transmission and outbreaks and therefore delay the onset of what might be community transmission. However, in many countries, there's also community transmission occurring at the same time, and that's also being studied to determine whether or not it will continue to spread at the same time that countries are preparing for a major outbreak should it occur.
Now, on that note, will we see second and third waves of outbreaks in places where the number of cases seem to be declining?
Well, there's a concern that that may occur, but no one is able to predict that with certainty. So what we need to do now is work as Singapore has worked to stop outbreaks where they're occurring and to try to understand how disease transmission might be occurring or might occur in the future, and at the same time getting hospitals ready for a surge of severely ill patients who need respiratory support if indeed that surge comes.
Now, Professor Heymann, just a final question. How soon can a vaccine be available, and will that solve all our COVID-19 problems?
Well, there's a lot of work now to develop a new vaccine, and it's probable that that vaccine might not be available and licensed before early 2021. After licensing, then, there will be a need to find production facilities that can produce the quantities of vaccine necessary to deal with this outbreak should it continue. So we're a long way away from having a vaccine that's licensed, and then even further away from having a vaccine that's available on the shelves ready to use.
Well, thank you so much, Professor Heymann, for your insights. That was, of course, Professor Heymann. Now, it's been a pleasure, Professor, and we hope to speak to you soon.